First of all, thank you, Gal. It's an honor and a pleasure to be part of a series of such important and impressive talks. It's also a hard hour. It's a little tough. So I want to share three thoughts that have nothing to do with the content of my talk, and then maybe if anybody wants like 60 seconds to stand up, drink water, slap themselves, slap the person next to them to wake up. Um, so the first thought is that I was thinking that I actually don't know what year it was, but I think the first ever Israel meeting for autism research was in this room, right? 2019 was in this room, and it was only in this room, and I think we fit very comfortably. Um, right before COVID, so it's exciting and really impressive that now this is one of the rooms in which the meeting is taking place. It's really cool to sort of have that perspective. Um, the second thing I wanted to do was, it's been said before, but I want to share my hopes and prayers that the hostages all come home, and in general, that our part of the world sees simpler times in the near future. And the third thing I wanted to do was wish Ramadan Kareem to anybody who is celebrating now. Okay, so maybe 60 seconds, just like, I don't know, stretch, wake yourself up. I could use a little bit of a stretch before I get going. Yeah. I'm not gonna like lead you in calisthenics or anything, but okay. You can keep stretching while I start. That's also totally fine. Okay. So in the next 15 or 20 minutes, I'm going to share with you first the context for our work, both in terms of the literature in which it sits and also in terms of the lab in which it takes place. I'll talk about two papers that are currently under review and findings. I'm sort of cherry picking some findings from those papers related to family accommodation in young autistic children. And then I'll spend a few minutes at the end talking about the things that we're working on now and a little bit about where we are headed in the future. So before I begin, it's important for me to acknowledge that the work, as you'll hear, the work in our lab is it's a little bit cumbersome, and it demands a lot of people and a lot of time and a lot of effort. Many of those people are actually in the room today, and so I want to acknowledge my lab members who are here today. Specifically, I want to point out Tamar Matz-Weissman, who's on your left, and Toby Gracher, who's on your right. Toby's abroad. Did Tamar leave already, or is she here? Wonderful. So the way I'd like to do this is all positive feedback and compliments can come to me, and all negative feedback and criticism, Tamar will be there after the excuses. Tamar is here. I'll give you her email address. Okay. Our field, for decades, has invested endless resources into what we call parsing the heterogeneity in autism, trying to understand why and how so many individuals who reportedly belong to the same group can be so very different in so many ways. Attempts to explain this heterogeneity have largely focused on intrapersonal characteristics. We talk about brain and cognition, genetics and gender, language and communication, autism symptom expression, and co-occurring diagnoses, just to name a few. Significantly less work attempting to parse this heterogeneity has taken an interpersonal perspective. Specifically, we have largely neglected consideration of perhaps the most foundational relationships within which children develop, relationships within the family. And specifically, I'm talking about parent functioning and parental behavior and how that associates with development over time. Now, it's possible that this lack in the literature stems from autism's dark history of parent, or specifically mother blaming. But I think it's not controversial to say that parents, families, and caregivers impact the way in which their children develop, whether those children are autistic or non-autistic. Although it's worth saying that exactly how we influence our children and through what mechanisms remains somewhat elusive. Our lab is focused on doing just that, attempting to understand the interactions between inter- and intrapersonal contexts that associate with the development of autistic children over time and can be used as ports of entry to supporting their development. To that end, together with the National Center, And with generous support from the Aviv Foundation, 3 years ago, we had the privilege to set up a fairly unique clinical research infrastructure in our lab. There, we see children who were referred for an autism evaluation from the community for a no-cost, gold standard diagnostic assessment. Initially, children come in between the ages of 18 months and nearly 5 years. In addition to a developmental or cognitive assessment and a diagnostic assessment, we collect data using many parent report measures, as well as experimental paradigms that we run in the lab. Families who are diagnosed in our lab are then referred, still at no cost, through our collaboration with the National Center, to Dr. Adi Aran in Shaare Tzedek. I don't know if he's in the room. I won't judge if he's not. Who conducts the medical evaluation that's legally mandated by the Ministry of Health, such that while we receive invaluable data, families receive a detailed report and a formal diagnosis that is fully recognized by all public systems and ministries. 6 months after families come into the lab, they fill out online measures again, and 6 months after that, they come back into the lab, and we do it all one more time. We are proud to this point to have seen over 200 families in this context, having conducted evaluations in Hebrew, Arabic, English, and Russian. The first research questions that we asked in the context of this infrastructure are those that I'll be discussing today. These questions revolve around the notion of something called family accommodation. This refers to ways in which caregivers modify their own behavior proactively to help a child reduce or avoid distress that is related to a disorder or impairment. This construct has been studied extensively for over 3 decades in the context of OCD and anxiety, where countless studies have shown that increased family accommodation leads to higher symptom severity, poorer psychosocial functioning, elevated caregiver well-being, and a whole slew of other negative outcomes. The field's understanding of family accommodation in the context of OCD and anxiety reached the point where our partner in this project, Professor Eli Leibowitz, who you see there of the Yale Child Study Center, developed a parent training program called SPACE, Supportive Parenting for Anxious Childhood Emotions, which targets family accommodation, does not involve any direct work with the children, and was found very impressively to be non-inferior compared to gold standard cognitive behavioral therapy. Given the partial phenotypic overlap between OCD and autism, we embarked on a bit of an odyssey. Using the work from the anxiety world as inspiration, nearly a decade ago, we began a series of studies trying to ask whether or not parents of autistic children accommodate their children's RRBs, and whether or not this may be a potential mechanism for both understanding and supporting development and improving the well-being of these families. Together with Eli Leibowitz and Ditsa Zachor, who is here in the room, of Asaf Arofeh, Shamir, I don't know what we're calling it these days. Back in 2019, we established the existence of this dynamic in a heterogeneous sample of children and adolescents, and we found a remarkably strong correlation, above 0.8, between family accommodation of RRBs and RRB symptom expression. In that study, and throughout subsequent papers, both by us, as well as an important mixed method study by our colleagues at Haifa University, family accommodation has been linked with autism symptom expression, elevated disruptive behavior, higher support needs, and more parenting stress. Finally, in a small intervention study we ran in our lab a couple of years ago, adapting SPACE to target co-occurring anxiety in autistic children, we showed that parents of autistic children can reduce their accommodation behavior, again, accommodation of anxiety in this context, and this reduction was associated with improved symptomatology, meaning a reduction in anxiety. What you see on the screen here, for us, encouraged us to conduct a more nuanced developmental study to try and understand this dynamic from its earlier stages and consider its viability as a mechanism for intervention. We set about doing this, considering child, parent, and systemic variables, looking at child's autism phenotype, cognitive and adaptive functioning, behavioral and emotional regulation, as well as aspects of parents' emotional, cognitive, and social functioning. We've collected this data in our lab for the last 3 years and are just now beginning to be able to explore this phenomenon in a developmental context of autistic children and are beginning to understand a little bit of what's going on. I'll now present some of our early findings from this work, focusing mostly on cross-sectional data from T1, time 1, and I'll also present some of the preliminary longitudinal findings. So Tamar's doctorate began with a sample of 87 autistic children, 67 male, from the first time point, by asking simply to what degree do mothers and fathers of young autistic children accommodate their children's RRBs. For the first time, we also measured and considered teacher accommodation of RRBs for those same children. We then looked to see how accommodation of mothers and fathers associated both with each other and with other various clinical characteristics and outcomes. So in line with previous work, nearly half of these parents accommodated on a daily basis, and nearly 80% of them accommodated at least a few times a week. We found that teacher accommodation takes place at comparable, if slightly higher rates for those same children. We again found that both mothers and fathers who accommodated their children's RRBs more had children with higher levels of RRB expression. And we found a strong correlation between maternal and paternal accommodation. I will say that in our sample, I believe we had two same-sex couples, and so we were unable to include them in these analyses. Maternal accommodation also associated with adaptive functioning, while paternal accommodation did not, because dads. Interestingly, even though teachers reported similar rates of accommodation to the parents, we did not find any correlation between teacher accommodation and any child characteristics, nor with maternal or paternal accommodation. This is partially due to the fact that teachers reported only on their own accommodation behavior, while the data on the symptomatology and functioning was collected mostly via parent report. But that's not the whole story, because we also looked for that association between teacher accommodation and RRBs and symptomatology as measured by the ADOS in the lab, and there too, we found no link. So what this means to us is that we don't really understand the significance of teacher accommodation, although it's something that obviously takes place, and it's something that we're considering now how to study in the future. So far, we've looked at how parents accommodate their children's RRBs in the moment, cross-sectionally. But what happens over time? Does accommodation naturally decrease? Does it persist? What are the long-term effects of accommodation on child outcomes? So here are some preliminary findings on how maternal accommodation at the time of diagnosis at T1 predicts key outcomes 1 year later. Again, cherry picking. We found 3 key patterns that I think are worth highlighting here. First, maternal accommodation looks like it's highly stable over time. So mothers who accommodate their children's RRBs at T1 are very likely to continue accommodating at T3, meaning accommodation patterns seem to be relatively stable. Second, higher maternal accommodation at T1 predicts greater RRB expression at T3. I do want to sort of open a parentheses here. When I say greater RRB expression, I'm not talking about positive or negative. Some of these are adaptive, some of these are maladaptive. I'm just talking about quantity. There's just more RRB expression happening a year later. So higher maternal accommodation at time of diagnosis predicts higher RRB expression a year later. There's a moderate positive correlation here, which raises an important question that we can't answer based on this. Is accommodation reinforcing those RRBs over time, or is it a response to the child's symptomatology? The third and final longitudinal finding that I'll present here is that maternal accommodation at time of diagnosis at T1 did not predict adaptive functioning at T3 a year later, suggesting that maybe accommodation predicts specific behaviors, but may not predict specific outcomes, broader developmental functional outcomes. I want to shift now from talking about behavior and functioning to talking about emotion. So Toby Graucher's work, she's not here to receive your criticism, but you can pass that to Tamar also if you want, and she'll pass it on. Toby Graucher's doctoral work focuses on emotion regulation in young autistic children. Emotion regulation is defined as the way in which we influence which emotions we have, when we have them, how we experience them, and how we express these emotions. The literature, and there's a sizable literature on autism and emotion regulation, the literature shows fairly clearly that autistic children have emotion regulation or ER profiles that are distinct both from typically developing children and from children with other developmental delays, or DD children. These differences include increased attentional difficulties and negative affect, lower levels of effortful control, meaning regulation of attention and inhibition, and lower surgency, which includes high activity levels, impulsivity, and approach behaviors. We also know in general how important emotion regulation is in developing social competence, and that difficulties in emotion regulation lead, or even synonymous sometimes, with mental health challenges like depression, anxiety, aggression, and that those in turn are associated with autism. So here too, Toby is looking at cross-sectional data, beginning by looking at cross-sectional data from time one of our evaluation process. She began by looking at a sample of 82 autistic children compared to 27 DD and 23 typically developing. Her focus here is on both child and parent emotion regulation, and I'll highlight some findings from this paper that stand out to us. So first, in looking across our groups, across these three groups, we found that the typically developing group had significantly higher adaptive functioning measured by the ABAS compared to the developmental delay and the autism groups. There was no significant difference between the developmental delay and the autism groups. It's important to say that we're hyper aware that our DD group, our developmental delay group, is a group of children who came into our lab for an autism diagnosis. And so this is probably not representative of the broader developmental delay community. However, at the same time, they are quantifiably developmentally delayed and not autistic at the time at which we saw them. Comparing groups on effortful control, again, children's ability to regulate attention and behavior through voluntary effort, we found significantly higher effortful control scores in the TD group compared to developmental delay, and again, no difference between the developmental delay group and the autism group. This scatter plot, so we're going to look at a couple of facets here of child emotion regulation and the way that they associate with family accommodation. So this scatter plot illustrates the relationship between family accommodation and negative affect. Negative affect, things like sadness, frustration, anxiety. And what we see here is a general positive trend. So as family accommodation increases, so does negative affect, suggesting that when parents accommodate more, children's negative emotions may intensify rather than decrease. This aligns with what we've talked about, right? Suggesting that more accommodation may be reinforcing emotional difficulties rather than helping a child cope. But the trend here, okay, the trend here, the trend here is nonlinear. So when there's less accommodation on the left side of the scatter plot, even small increases in that accommodation associate with significant increases in negative affect. But as we shift to the right and higher levels of accommodation, this relationship seems to flatten out. Here on the y-axis, we see surgency. So things like high activity levels, impulsivity. And again, I'm going to go a little bit quicker, but looking at the overall trend, we see that as family accommodation goes up, surgency slightly goes up. It's not as strong of a relationship, but here too, the effect is not linear. The relationship varies at different levels of family accommodation. Finally, here we're looking at the link between maternal accommodation and mother's use of expressive suppression. So expressive suppression, an aspect of parental emotion regulation, is an emotion regulation strategy that involves inhibiting outward emotional expressions, like facial expressions or gestures. I think I can identify with the mom who's holding that cup of coffee. Suppression is usually used to manage interpersonal interactions, but we know that it also associates with increased stress and reduced emotional well-being. Again, we see a nonlinear pattern. So I'm not going to go into all the interpretation, but basically it could be that the relationship, or it is clear that the relationship between maternal accommodation and expressive suppression is not straightforward, whatever it is, and it raises questions about whether highly accommodating mothers are experiencing increased emotional strain, and whether interventions should perhaps focus on alternative emotion regulation strategies to support children and parents. So I'm going to skip the summary. I guess if you weren't listening, you don't deserve the summary anyway. So I want to take the last minute to talk about what we're working on now. So much of our work today focuses on expanding our scope to include other inter and intrapersonal variables. So one of the posters you may have seen during lunch was presented by Tal Mensch-Lifshitz, who's here somewhere. A wonderful PhD student supervised by myself and Mor Nachum, with significant assistance by graduate student Rotem Lapidot. And that poster looks at the way in which parental cognitive control, social functioning, and family accommodation associate with child RRBs. Another poster that also has Tal's name on it and is also a collaboration with Mor, but this one is led by Shir Rosenblatt and her dog Johnny. considers a novel approach to measuring RRBs, using something called ecological momentary assessment, or EMA, as a stepping stone to subjectively identifying RRBs that are maladaptive for any given child. Finally, a third poster you may have seen, presented by Liraz Sasportas Joseph, or Yosef, I don't know how you want me to say it, I should have asked, and in collaboration with Anat Perry, looks at a construct that I'm super excited about that we call Tom squared. That refers to parents' ability to mentalize their child's theory of mind. So parent theory of mind of child theory of mind. In this study, we've taken children, administered a classic theory of mind task, and then administered the same task to parents, asking them to respond as they think their child would respond. And in that study, higher family accommodation was associated with what we call decreased Tom square accuracy, suggesting that parents who engage in more accommodation may have more difficulty mentalizing their child's theory of mind abilities. There's a lot of work left, but I will wrap up, and thank you very much.